Good morning. It is today. Wait, I'm Dr. Luth, and I'm Dr. Mia Luth. This is July 24th, 2026, and it is approximately 8:30 a.m. Eastern Time, New York, USA. And I'm just putting this out there. I'm in a bit of a difficult situation in some ways, but I mean, the end result here is that I can do some outreach myself, because say mental illness, all I can tell you is that I got diagnosed with PTSD a long time ago. And unfortunately, because of certain sensitivities, because of certain other things, and just like a lack of awareness in the general public around me, it just became a lifelong condition. So there's certain things that I do and I know, so I can, share some of those coping mechanisms and with others, and for that, my hope is that somebody may have a temporary situation, and it isn't just military, okay, that it happens to. And so also my hope is that get more information out there, a little more awareness, a little more understanding, and share some coping mechanisms that it'll help reduce the number of people who end up with lifelong PTSD. So it's sort of something you go through, and then you get recovery from it, and then eventually you just don't have it anymore. So I mean, that is why sometimes I put certain content on this. This is a multi-purpose channel. But again, I'm going to reiterate, this channel is not meant to be monetized, okay? Okay, this is not my source of income. And also, if there's educational information on here, it's okay to use it for educational purposes. Just, you can't edit and change my words. You understand? Because that's inappropriate use, and that can get you into some trouble. But if it's useful and you want to use little blips of it for educational purposes, that's perfectly fine. We can do that for free, and as long as it's people know it's Dr. Mia Leaf, that's who I am. So that's that there too. But I am doing a little outreach for interested people who might have a little extra money, or who have, maybe you work for a furniture company that's going out of business, I don't know. But in Cecil County, Maryland, Elkton, Upper Bay Counseling and Support Services could use some, either really clean, used furniture, especially things that are metal and hardwood that can't possibly hold bed bugs, or new furniture could use some, just regular household stuff. Could use some of that, and anybody interested in maybe helping to establish a couple grant positions, and like adult autistic advocates and people who are really aware and have awareness of adult autism and work with them and know, have information and could partner up or, offer a helping hand in some way or volunteer a little. I am not really sure. There is a distinct sort of lack of awareness and knowledge, and there are autistic adults in the programs, and so it would be helpful. Grant positions, private donations for like medical equipment and updates to certain housing to make them safe bars, for the shower bathroom remodels so that there's, safety rails and some other things like that. Air conditioners, room air conditioners are always helpful. I'm trying to think. There's a few things. I'm trying to think of the general population, what kind of things. People sometimes donate clothing, new or used, all different types and sizes. Like hygiene products, like shampoo, conditioner, underarm deodorant, hand lotion, toothpaste, toothbrushes, especially sensitive toothpaste. Mouthwash, fluoride rinse, and mouthwash that doesn't have alcohol in it. Those kind of things come in handy. What's it called? Dish liquid. Clocks, wall clocks, battery wall clocks that are silent. That they don't make the ticking noises. Like all of those things could come definitely in handy. Let me think. I'm trying to go through what kind of paper towels, toilet paper, mops and mop buckets that are like easy to use, and preferably where you don't have to do a lot of bending. There's some people physically have difficulties who are more, easy to use, the spin thing or the push thing or the quickie mop, anyway. And the mop heads replacements, those things are used all the time. Body wash. But yeah, with the toothpaste stuff, yes, sensitive toothpaste. It's, people who don't need it can still use it because it's got everything you need. But the people who do then will have sensitive toothpaste. So, that would definitely come in handy. Soft bristle toothbrushes, things like that. Towels, washcloths, oven mitts, right? Just those kind of things be very helpful. Supply closet kind of things. So I'm trying to now think the day program. There is an art grant but sometimes art supplies, but new is better. But sometimes like acrylic paint gets used a lot. I'm not really sure. There's the Jewelry Guild, which people can make their own. It's not high end anything, okay? You get what I'm trying to say, but or they make them and then once a year they get sold so that you can buy more material for the following year. But those things come in handy. Some people like to use glass beads. Some people, just whatever. Okay, those things come in handy. Sometimes it's some office furniture, things like that. But if you're not really sure and you do see this and you are interested, or you know someone who is, you can call Upper Bay Counseling and Support Services. Okay, their general number is listed online. And you can just, when you talk to somebody, say that you would like to donate something, or you like to talk about helping out with a grant, or trying to see if you can offer some help when it comes to understanding adult autistics. Or you do a certain kind of training and you're willing to, do that training for maybe like just regular, I don't know, maybe work out the pricing, because it's a 501c3, so it's a charitable organization. I mean, this is just something, but also if you work for HUD or Section 8 housing or state of Maryland or anything, we do have a situation at Elkton Meadows that is deteriorating very quickly. There is only one, there's more than 100 units here, and there's only one part-time maintenance guy, and the lawn doesn't get done the way it used to. Things are starting to, degrade to, there's a lot of people without doors, there's a lot of people with holes, and there's a lot of people, electric may need to be updated. These things are just falling by the wayside at this point, and they don't even have someone in the office all the time. It's basically from 9 a.m. to 1 p.m. Monday through Friday. No one on the weekends. And so, maybe some time and attention to, make sure this place doesn't go down the crapper. Okay, if this like headed into slumlord territory, and there are disabled people, there are elders here, there are families here, and and then there are people who are on subsidized housing who are generally decent residents and try to keep their areas clean, and so on and so forth. So that is also becoming an issue. So policymakers and politicians may not understand it's not just about the mental health. There's some disconnects, and it's like I said, like some of these people, especially residents, I mean, some of them should be in speech therapy. So, like Medicaid and social services and others who, right? And so there needs to be more awareness of that. Some of them should be in physical therapy like all the time. Some of them should have occupational therapy. You understand? There are things that are actually medically necessary, and in some cases, Medicaid. Which, by the way, everyone, okay, in the state of Maryland, is like the term that's typically been used is called medical assistance. In Maryland, Medicaid is synonymous. You understand? I've been accused by a doctor, told me I was misleading people by calling it medical assistance, and I'm like, no, an MCO, because these things have changed over the years, so that term is not used as much, but it's an MCO, which is a managed care organization, which is state insurance, which is Medicaid. Okay, and there's a difference between Medicaid and Medicare. And some of the things that Medicare doesn't cover, there may be some need to get a little more like biological nursing. That's why I'm saying maybe a grant position to liaise and travel to make sure these people are going to the appropriate therapies. You see what I'm getting at? There's some who could really benefit from speech therapy. And technically, I'm supposed to. Okay, but the only requirement, apparently from the state of Maryland, is that these clients go once a year to a primary care physician. Okay? Like glasses, teeth. Some may not want to go, okay, but they're adults. They need to be handled a little more like adults and not children. Sometimes they need to just suck it up. And maybe they have like volunteers who go and sit with you and help you and encourage you, and like when you're scared, and they hold your hand during certain things. This is what I'm saying. It's just like, it's not even appropriate. So there is a disconnect, and there needs to be more awareness. Some of these people would be doing much, much better if they could actually get to, and sometimes Medicaid pays for it, but transportation and scheduling and all these other kinds of things are severely lacking. Okay, so I'm allowed to try and talk to politicians, people. It happens. Politicians sometimes sometimes they want to know some things. They want the actual perspective of people that are going through it. Unfortunately, there's people in social services and here, the system is broken. I'm just like, okay, shut up. Maybe it's not. Maybe it's just people need to make efforts to liaise a little better, more positions that have liaise between this and that, and who are understanding it isn't just about a mental health condition, that sometimes it's their physical people bodies need to go, and a lot of them are missing out on occupational therapy that they could do, speech therapy that they could do. Medicare, Medicaid will cover some of this stuff, so some of it is covered, but there's just not enough, caseworker, liaison of the public and is, trying to get all these people covered, and it's just, It's only broken because y'all keep repeating like broken fucking records. Well, the system is broken. The system is broken. Like, because you're a quitter and you need to step away. And somebody who, knows how to persist and knows that you can, get information to politicians and you can reach out to the general public and advocates of certain things and, let some people know here's where, there seems to be a little more of a disconnect. Okay? So, more enriching activities that, maybe a qualified volunteer could, spend time and really, more one-on-one with certain individuals and small groups. Okay? Nothing is truly impossible in those ways. Okay? The people who are walking around, well, the system is broken and the system is broken. I was like, yeah, wrong. Like, you might be broken in some way, a broken record, like someone told me, well, if you're not here, they'll be homeless. I'm like, bullshit. You liaise. Okay, Elkton is right next to, we're very close to Delaware, right on the line. Like, some people with Medicare, you understand, could get resources in, Medicaid's a different story, okay, but Medicare people could, and go and get in Delaware. There are some things, okay, right? There may be some churches, there may be some other organizations, United Way, I don't know, but no, maybe it's not, maybe it's just overloaded and people aren't aware of certain things. And some of these people, okay, if, there should be more residential assistance, and no, some of them won't. They can go to Pennsylvania. They can get on a list for another county in the state of Maryland, because Baltimore County may have an opening and they can go there. The city, there's some Anne Arundel County, Montgomery County, you understand? Hey, we're also close to Pennsylvania. So some of the Eastern Shore counties are, less populated, but they do have, some resources, and maybe, somebody, we get volunteer driver doesn't mind taking a trip, 2 hours that way once a week or something. I don't know. You see what I'm saying? It's just like, no. The people who are, oh, well, but the system is... You are not suited for the position you are in then. And you do kind of need to take a refresher and step away. And if you come back and you're still, well, this is only about that. It's like, no, they won't. Okay? There's resources all over the place. You can outreach to Delaware for Medicare patients. There are possibilities there. We're not that far. But Pennsylvania. There are certain institutions that are, not really horrible places. They're not being experimented on. Like, a lot of that stuff just doesn't happen anymore in the United States of America. Okay? Some of these people really shouldn't be walking around unsupervised. Well, the state of Maryland should really require, all organizations like this, charitable and others, deal with these kind of things. Right? They need to get their eyes checked, and they need to go to the dentist. can save a lot. Money, time, misery, pain, anguish. You understand? Like, unfortunately, these people aren't really progressing. And, I mean, this place could use at least, 4 more caseworkers. And someone who, spends one-on-one time with clients. That's what I'm saying. Grant position, skilled volunteer. There are things, basic household things that there some positive changes need to happen, which means better awareness, a little more understanding, a little more outreach, different kinds of partnerships. Nobody, the state of okay, this is not a blame situation. It doesn't fucking matter, okay? We can find where some things kind of get slowed down and where, some viewpoints, there are ways. Okay? So, I'm saying it out loud. I know there are. I don't get paid. It isn't my job to be doing any of this. But to be honest with you, some of you are getting paid. Maybe you're burning out. I don't know. Maybe, you only want to do the bare minimum for these people. And that's not really okay. Some of them have physical ailments like I do. I mean, that's where, a good portion of my depression comes from. Because my mobility issues, with my neurological system that people don't quite understand, and yada blah blah blah. Plus, I'm on the spectrum, and I don't have family support because they're deceased. And some of these clients can be abusive with one another, and there's really no reprieve. There's no way to, you understand? So this whole thing needs to be looked at far more carefully, and there needs to be far more, outreach, partnerships, understanding. Here, unfortunately, it's not okay, but it happens. Clients with certain difficulties can be highly abusive to other clients. It's been happening to me. And so it can happen to others too. They're, how they are on the spectrum, or how they are schizophrenics, or whatever. You see what I'm saying? Okay? But some of these people do know right from wrong. And there's a few in the program called Sunrise, which is residential, who just shouldn't be in the program. They need to move on. Some are actual criminals, and unfortunately, Upper Bay's been taking one in particular all around stores, and that person's unsupervised at farmers markets, and just comes back with items she didn't pay for it, and it's been happening for years. So I was that person's roommate for a little while, and she tried to hide it from staff. So when you try and hide something, you know that it's wrong. So mental illness, whatever the fuck it is, does not, can't be used as a reason why this person is allowed to keep doing this. Right? So Okay? Some people here should not have control of their own SNAP food benefits. I mean, they sell them. There's issues here that need to be handled. And more interdisciplinary students coming up. Biology, psychology. Right. More interdisciplinary students, you understand? Sociology, biology, sociology, psychology. You understand? Right. So, and management, for human well-care. Okay, so, more interdisciplinary studies, more people who are used to seeing certain sides and seeing how they relate and seeing where there might be, something that kind of falls through the cracks. Okay? I'm getting a little tired of being abused by other clients, and they don't even think they need to apologize. Some of these people can actually have their behaviors corrected, and that's just a true story. And some of them shouldn't be here. Okay? And so this needs a serious look. And some serious people who are working toward improved a lot of stuff. Okay? But the people running around saying the system is broken, okay, you just learn to ignore them. They're quitters. They don't want to do outreach. They don't really want to, get involved. Maybe they're burnt out. Maybe they're just in the wrong kind of job or career, and some, more patient and people who are, good at coordinating should be involved. Alright, well anyway, so that's my spiel for today. Try every day to be just coach more patient with yourself and others. That's it. Just teeny tiny. You know what I'm saying? Just a wee tiny little bit every day. Okay? And you do that every day. Eventually, certain things it's like building patience. You don't have to let people run over you. I'm not trying to say that. I'm saying, you can stand up for yourself, you can stand up for others, but you also have to, see the reality of the situation to know, losing my cool really isn't gonna affect or change that. It's just gonna affect me. And so some of that is for your own, sake. But, yeah, okay. But I'm gonna say this statement. Love knows love. Light knows light. Okay? I mean, it is quite literally that simple. So, alright, take care.